Hi, I'm Dr. Brian Parsley. I am an orthopedic surgeon, and I'd be happy to welcome you into my practice. What does hip arthroscopy entail? Hip arthroscopy is an outpatient procedure where we can come in and when utilizing 2 or 3 small incisions around your hip joint and putting you to sleep, we then put your hip into some traction so that we pull the ball away from the socket and allows me an area to work in or get into your hip joint so I can make a general inspection and evaluation of the hip. Once I'm there, I'm able to look at the cartilage surfaces of your hip. I'm able to look at the cartilage rim of your hip, the way the ball and the socket articulate or move on one another, and evaluate where there may be a problem of a tear or an injury or a loose body or other issues. We are commonly seeing a problem called femoral acetabular impingement as well, which may be a problem that you're experiencing that has some limitation of your motion and is a cause or potential cause of pain. It also can be the source of early degenerative changes in your hip. So it's important that we take a look, and a hip arthroscopy allows us that opportunity. The beauty of the procedure is that it can be performed in less than an hour or hour and a half, and it's an outpatient procedure. So once you awaken, you can go home. And it's minimally invasive. What does minimally invasive mean? Basically, we're able to perform this operation through 2 or 3 small incisions around your hip. These incisions are covered with a small gauze and a waterproof dressing at the end of your procedure. Operations of this type can take anywhere from a half an hour to an hour and a half in time. And afterwards, it's an outpatient procedure, so you're able to go home. Your recovery time from a hip arthroscopy is very variable depending on the extent of work that's done. If it's a simple soft tissue procedure around your hip, such as removal of a loose body or removal of some of the inflamed lining of your joint, or a small trimming of the cartilage surface of your hip, then you may get back to full activities within a matter of 2 to 4 weeks. If we do more extensive work or bony work around your hip, then we may need to protect your hip for anywhere from 2 to 4 weeks and then graduate an exercise program and elevation of activities over the next 4 to 6 weeks after that. So it varies depending on the problems that you might have, but all of these patients have significantly less pain and suffering than we do when we have a more involved procedure or what we call an open procedure where we have to go in and operate on your hip. Certainly the recovery time is even a little faster than we see with our hip replacements going forward. So as a minimally invasive procedure, it tries to be very joint preserving, meaning that we will try to keep your hip in place instead of going to an artificial hip for as long as possible.